Well, thanks, Mark. That was a fantastic sort of platform. And I was very interested in your 10th point, which in a way is what I want to try and argue for today. So I'm Tim Kelsey. I'm the National Director for Patients Information in NHS England. And what that broadly means is that I'm responsible for all the national policy and delivery of technology, data and information, and for really making the argument that one of the key, if not the most important strategies we can deploy as we think radically through how we have a sustainable health and care system in the future is simply to unleash the power of people. That's something that lots of other industries have done really successfully, but for some reason or other, and I don't know why, but it's a question each one of us will need to ask ourselves, we collectively leave our brains at the door when we turn up to walk in the health service. I have a risk of cancer in my family. I have a risk of colon cancer. And about a year ago, I went along to the GP where I live in Somerset, and he suggested I should have a colonoscopy. So I got the letter back from him, and Choose and Book appeared to work. I was quite pleased, since I'm responsible for it. And I was given a kind of selection of 3 places I could go, and made my selection, and back came a letter with a date for an appointment. I had of course, no input into when that date was assigned, but it was sort of 6 months after I'd been to see the GP. So we waited, until the date came along, and then, very unfortunately, amongst the many daily challenges of working in NHS England, I suddenly had to go to a board meeting and was unable to make this appointment. But I rang in advance to say I was going to miss it, and I just assumed, completely stupidly, that somehow I'd just be given another appointment. Anyway, they said they couldn't tell me anything on the phone, so I waited, and I got a letter back after I'd, as it were, missed the appointment, so I was now categorised as a did not, DNA, did not attend. And the letter simply said that the policy in Somerset was did not attend, didn't get a second appointment. So unless I went back to the GP and round the house. Now, my GP happens to be a really nice chap, but it's a very backward practice. I mean, to be honest, their internet site barely works. They don't take phone calls other than with the most limited window of opportunity. If you want to get anything done at all, you just have to go to the practice. So I ummed and ahed about this, and in the end I thought I'd ring back the Choose and Book referral centre that the local trust ran and say, beg them if they could just send me another letter and get an appointment. She said, absolutely, I can't do that. And so I finally went to the GP. He made me another appointment. And then I discovered that not only couldn't I get an appointment, I had to wait until there was a cancellation before they'd even consider, even though he'd re-referred me, getting a second appointment. So at this point, I sent an email to the chief exec, who's a friend of mine at Musgrave Park, saying, we have got to sort this out. This is an intolerably, so at least a year had passed by this point. This is just an intolerable level of customer service. It is intolerable. This has got nothing to do with technology. It is just basic common sense. If half your GPs will not use Choose and Book, then let's change Choose and Book. And if they will use Choose and Book, but your own systems are so antiquated, you just can't make it work for people. It's just got to stop. And I went in finally to have this bloody appointment, which turned out, by the way, to be an outpatient appointment before I have the actual procedure. I've now got to wait another 3 months before the actual procedure happens. And we all sat down, me and the Choose and Book team and the Deputy Chief Executive, and we said, we've just got to sort this out. Let's make Musgrave Park an exemplar for the whole of England. And I'm sure there are far better examples, but the reason for going on and on about this is that at the beginning of everything that's wrong with the health service, you start with these stupid, degrading, administrative experiences which are unacceptable and do not happen in pretty much, even BT can do this now. You can actually ring up British Telecom and they will turn up broadly when they said they would, and you can get a second appointment. So I advocate this is completely nonsense. And then more or less every day now, and we're doing, I hope you'd agree, but I think my team on Patient and Public Voice at NHS England is doing some amazing things to truly engage all sorts of voices around the community in thinking through these challenging issues. And literally every day now that we opened our door properly, I get far more serious issues about people who are being treated with a level of indignity, frankly, that is breaking them. That they're finding their lives being turned upside down just because it's very hard to catch a bus when there are no buses in rural England to get to an appointment that you had no call in making. Just one other quick example, these things in the end resonate, was somebody very famous in healthcare who's just retired. His dad, 90, got exactly the same thing, got a letter from the local hospital saying, you've exercised your right to Choose and Book, and here's your appointment. And the poor chap was in total turmoil because the date of this appointment was the date of his wedding anniversary, which matters when you're 90, I guess. And he couldn't understand how he'd chosen that appointment. Clearly, he would never have chosen the day on which his wedding anniversary occurred. And what in fact transpired was that the GP, thinking he was too old, had chosen the appointment for him without any reference back to him. And unfortunately, because he wasn't going to make that appointment, he had to go back on the circuit again and wait yet again for 2 or 3 rounds before he finally had the appointment made. I get a lot worse examples than that most days, and I reflect that actually this level of administrative stupidity starts getting really serious very quickly. So we look at something like the NHS number. You know, we have one of the world's finest systems for identifying patients, yet there are hospitals, and some in this room, I'm afraid to say, who have multiple identifying systems in their hospitals, meaning that they are at serious risk of literally losing patients as they travel between wards, or even worse, actually losing patients between prescriptions. I had it within the same hospital. I had one case in which somebody very nearly died because the hospital couldn't tell it was the same person between 2 different non-connected pharmacy processes inside the unit. And as we know, of course, from Francis and Berwick, this is ultimately a matter of life and death. At the very worst end of it, it starts with a lack of communication, some poor person just being left in a ward without the hospital without any knowledge of that, or any institutional knowledge of that person, and ends up with people actually dying or being harmed. So my argument is that we now need to move very, very rapidly, without any delay, towards a future in which the person, the citizen, the patient, particularly within hospitals, but more broadly within the whole community of health and care, is recognised. The key to this is the ability of the system to remember the person. Cyril over here, just as I was a bit earlier, showed me a piece of paper which is allegedly the system for treating frail elderly people in London, and it's ludicrously complex. It has about, we have to show it later, 100 boxes. This is the sort of the neat way in which we connect everyone together, because actually our underlying our ability to participate with patients in most cases is close to zero. We don't take the technology seriously, we don't take the data seriously. So my job in part is just to make the argument that if we want a sustainable healthcare system, we are going to have to do things really differently. It's not difficult, it just needs leadership, commitment in my view. So very quickly, just to give you a sense of where I think you might be thinking as you start to unravel this problem of a sustainable healthcare system that is fit for the 21st century. I've approached this really in 2 broad ways. I've said that transparency, i.e. the ability for data to flow and be shared, is a fundamental precondition for a customer service and a safe health service. And the second principle on which I've based the argument with my colleagues at NHS England is around participation. So this is the effective use of all sorts of different channels, not just digital technology, to empower people to take more control for themselves of their care. And it is true, of course, that in the end we all want the chart that you demonstrate, home care at one end and hospitals at the other. But actually I think there's a sort of fuzzier edge to this, which is about recognising some people can move more quickly than others in grasping the nettle as individuals of the ability to take control. And we want to empower those people as quickly as possible, even if the whole bloody system can't move at the same pace. So just to tell you a little bit about transparency and things I think you might want to think about quickly. As I said, for me, if I can achieve only one thing, it will be to have supported the NHS, particularly the larger providers, in using the NHS number as the primary identifier on everything. I believe that the future of the health service, it sounds absurd to say it, depends pretty much just on that one standard. If we can't make that happen and we end up with large hospitals continuing to have multiplicities of patient identifiers, there is no possibility of integration. You'll never be able to link health and social care together. One of the big opportunities that the Integration Fund offers us now, and it's a criteria, I'm sure you all know this, for local authorities to be able to draw down on that fund, that they do use the NHS number as their primary identifier. And I think that we in the NHS should be massively supportive of that opportunity. If we could raise that to the surface, we're going to do everything we can to incentivise people to do this. We could imagine a health and care system in which the data really did flow. I mean, it's a shaming for me, to be honest, to have to sit in front of the Secretary of State and set a target for December 2014 that by that point, 1/3 of ambulance trusts in this country will have a primary care record in the van as they travel to see the patient on the ground. I mean, surely we should be capable of making sure that an ambulance in the 21st century has a primary care, an insight into the patient they're about to treat before they arrive at the scene of the accident or whatever. And actually, the best I can do at the moment is to get to a third, which is shaming for all of us in the room. And that's all to do with the NHS number. The second thing on transparency is the absence of data. So there are really, really important things we just do not know. If we continue not to know them, we definitely won't have a health service in 10 years' time. And one example which Mike Richards has correctly lobbied me about for ages, and we're now about to do something about, is the complete absence of any insight into chemotherapy treatment in this country. So at the moment, we don't even know how many people we treat with chemotherapy, let alone with what outcome. And that's because we just don't collect the data in a useful way or often at all. So there are things like this we need to resolve quickly, and as I'm sure many people in this room know, and I've got to thank many of the primary care community in London for having helped design the programme that we're now initiating. We've set up this thing called care.data, which in its first phase will effectively liberate much larger amounts of data from GP practice so that it can be linked to hospital data, and in that way provide the first baby step towards some level of insight into outcomes in a more integrated environment. That starts from next July. It's been a nightmare. You would not believe how difficult it's been to do, obviously, what Kaiser wouldn't even get out of bed without doing, in terms of just beginning to start making the case for shared data comprehensively across the entire NHS. But that is now beginning to happen. So that's sort of transparent. There are other things we're doing, but I think for me, if I was in your shoes, whether provider or local commissioner, I'd be asking a lot of very big questions about how, A, can NHS England support you, but how locally can you develop real strategies for promoting data sharing that is safe and patient-centred. The second sort of thing I was talking about, participation. So here we have a whole range of different approaches, by far and away the most important of which is that, as you've said before, we maximise the benefits that already exist, or the opportunities that already exist in primary care. So just by incredible good fortune, and with no pre-planning from what I can tell, we've invested a huge amount in digital technology in GP practices. We just have spent roughly about £5 billion over the last 10 years paying for reasonably decent systems in GP practices. And at the moment, there are quite a few of them that have done the honourable thing and sort of switched them on to do things like offer their patients the ability to book online appointments or to get their repeat prescriptions online. Quite a few, but by no means the majority. And things like even getting access to your online patient record is possible now, has been possible for some time, but actually hasn't in many cases happened for all sorts of reasons. So we're going to make that happen from March 2015. That's now the hard stop. Everybody will have to do it by then. And we believe most people do. They just haven't thought it through properly. But we think that simple digital tools like that could, in a different way, do something as transformational as happened in airlines or banking. So to be honest, it was just a combination of very simple transparency, access to my own data, with some pretty simple but obvious tools like being able to pay the bill, in this case, read across, being able to order an online prescription online, which could just have this, it could just tip the balance into the NHS becoming a truly social movement in a way we urgently need to happen. Just to give you, I'm sure, certainly all of KPMG colleagues will already know this, but it's amazing how successful online banking has been from the point of view of liberating the customer as an economic asset. So costs have been cut because now we are the clerks of the banks, and we are absolutely delighted with that new arrangement because it's given us a much greater degree of flexibility over our money, and actually we've become much better at spending our money than we used to be. And interestingly enough, I'm sure everybody can remember back to, well, perhaps not precisely, but back in 1998 when the first online bank in this country was launched, Kahoot, I can certainly remember being deeply sceptical about things like confidentiality and trusting the banks to handle my money in some newfangled computer system, etc. And I'm sure we all hesitated before we all thoroughly signed up to it. But today, do you know that of the adult population, over 22 million people now only do online banking, which is nearly 2/3 of adults in this country, and that took 13 years. So it's not unimaginable that we could halve that now that things have got moving and it's all got a lot cheaper. And maybe we can imagine a situation in which those that wished it, and that might be as many as 30 or 40% of our patients, could just do a whole lot more from home. It's not difficult to imagine that being potentially the case. One thing I just wanted to highlight in this, I mean, there's a lot of work going on in all sorts of different ways in promoting participation, but another thing you might like to think about is the urgency of your ability, if you're a commissioner particularly, but also I guess if you're a provider, to start developing real, transparent legitimacy for the decisions you're taking. And that means evidence that you are speaking to your local communities in ways that can be measured. So customer insight, any other industry would call it. We just haven't done it, really. We've tended to have the odd town hall meeting, do a bit of a survey here and there, but the idea of routine, flowing customer insight data just hasn't happened in the NHS. And we can look at things like TripAdvisor and other social media operations, and there are big lessons for us here. And even locally, you should be, I'm sure many of you are, grasping the opportunity to offer to your patients, your local citizens, the ability to feed back to you in real time on services, so that not only can you improve the dirty ward when you're being told that it's dirty, but also you can take all this data and turn it into a tool that I personally think in the future will become one of the most important management insights you'll have. So to that end, and again, huge credit to colleagues in London who have launched a pilot to this degree. We've launched something called Care Connect, and I'm sure many hospitals in this room are participating, but it's really the idea of giving people the ability to feedback multi-channel over the phone, tweeting, SMS texting, etc., for those comments to be published in real time on a website, on a map, so you can see, anybody can see the hotspots of complaint, people waiting more than X number of hours in a particular unit, and there are loads of them and you can see it. It's literally red when it gets bad and green when or blue when it's been resolved. And these hotspot maps convert into, as I say, a really important transparent tool of management for providers and commissioners. And we've stolen this hook, line and sinker from the US, where failing insolvent American cities used this device to completely turn themselves around as businesses, as well as sort of citizen-focused enterprises. So these are the things that are important. And in the end, my view is that the fundamental challenge we've all got is us. I think that we do leave our brains at the door when we go to work in the NHS. And I think that just leaders in this room deciding enough is enough, and that common sense, more than anything else, and just solid prioritised leadership will solve most of this problem of giving patients and citizens who really want the chance, a much greater chance to participate, will be the most important thing we can do to solve the sustainability challenge in health service. So my argument is the future is open, and it's up to us to engage it. Now I'm just going to show you a quick film which sort of summarises all that in a bunch of stick men playing with technology. Thank you.
Arthritis, diabetes, and then I had to go into hospital urgently. Arthritis, diabetes, and then I had to go into hospital urgently. Arthritis. It's brilliant. It's all here. Everything I told my GP. And all the team can see it. I don't have to repeat myself.
Mm-hmm.